Hi, I'm Janae.
I'm Gia.
I'm Els.
Hi, I'm Steve.
Okay. One of the most interesting things about modern medicine is its experimental past and archaic methods of trial and error that led to today's practices, especially in the emergency medicine. In emergencies, doctors had limited amount of time to test their methods before the patient died. But perhaps the most common known and seemingly simplest to understand emergency interventions is CPR, though many don't know its background. For hundreds of years, people have attempted to push air into persons who were no longer breathing in an attempt to revive them, though this would not be enough in most cases. In Amsterdam, during the mid-1700s, the main means of transportation cities were the city's many canals, and approximately 400 people per year died due to drowning. Due to the large number of drownings, a group of people called themselves the Society for Recovery of Drowned Persons began experimenting with new attempts to revive drowned victims, though many of their methods, such as bloodletting, were clearly ineffective. They did come up with some good ideas, such as elevating the person's legs. The few successes of the Society for Recovery of Drowned Persons were adopted by other various groups dedicated to medical science and practice. In 1775, a veterinarian named Peter Abergard began experimenting with chickens by killing a chicken with an electric shock. He could also revive with a counter shock. Finally, in the late 1700s, due to the experimentation of 3 different doctors, it became a generally accepted standard to apply cardiac massage along with the already established pulmonary resuscitation. However, the cardiac massage was mostly done by cutting the patients open and actually squeezing the patient's heart. It wasn't until 1933 when researchers at Johns Hopkins successfully documented the adequacy and speed of effectiveness provided by external chest compressions on dogs. Soon later, the same team added the then controversial electrical defibrillation. These, along with many other discoveries and innovations, led to the standardized versions of CPR that we use today. CPR stands for cardiopulmonary resuscitation. Cardio refers to the heart and circulatory system. Pulmonary refers to the lungs. The chest compressions used during CPR manually pump the heart and move the expired person's blood through their body. The heart alone is not actually strong enough to do this job. It relies on the equilibrium of blood volume and pressure, similar to water pressure in pipes. Today, patients in cardiac arrest that are being treated by nurses, doctors, or paramedics trained in advanced life support are given drugs such as epinephrine that constricts the veins, therefore increasing the pressure in their circulatory system, which causes the blood to move faster and at a greater velocity through the body during CPR. A functioning heart normally works by generating its own electrical reactions that cause its muscles to contract and pump blood. So basic CPR calls for the use of a defibrillator, a machine that shocks a stopped heart in an attempt to restart the natural electrical reactions. Pulmonary refers to the lungs and the respiratory system. All humans need oxygen. Our lungs suck in oxygen, then our blood delivers it to our brain cells and the rest of our body cells. If our cells do not receive oxygen, they begin to die very quickly. Since cells die quickly without oxygen, it is very important to start CPR immediately in order to preserve brain life. Our brain's oxygen supply is particularly important because if our brain dies, then our body can no longer function at any level, and our consciousness can no longer be manifested through our senses and actions. CPR employs different methods of manually delivering oxygen. There's mouth-to-mouth, which offers atmospheric air that contains about 23% oxygen. The BVM, bag valve mask, with 100% O2 from a tank with no airway advancement. Advanced life support uses tracheal intubation, which involves inserting a tube down the trachea to provide 100% O2 directly to the lungs from a ventilated machine. Once O2 is being delivered to the lungs, the blood circulation provided by chest compressions delivers it to the brain first and then the rest of the body. The current protocol by the American Heart Association describes that you start by placing the heel of one hand on the center of the person's chest and the other on top of that, and you want to push down hard and fast at a rate of at least 100 compressions per minute, going about 2 inches deep into the chest. After 30 compressions, you stop and give 2 rescue breaths. And then you continue that for 2 minutes, and then you trade with a bystander if you have one with you. If there is a bystander, you also want to call for help and get an AED. If a bystander does not perform CPR, the survival chances of a victim will decrease 7% in every minute of delay. Bystander CPR may be physically and emotionally taxing, but it may mean the difference between life and death.